Welcome to TGM Aware, the official podcast of the Gospel Mission in Sioux City, Iowa. Each month, we bring you real stories, honest conversations, and behind-the-scenes insights of the work of Rescue Women. From staff and volunteers to community partners and guests, we explore how lives are being transformed through Christ-centered care. Thanks for joining us. Let's dive in. Hey, Gospel Mission. Welcome to TGM Aware. My name is Nate Gates, the Associate Executive Director of the Gospel Mission, as well as the host of this podcast. And this morning, we have an awesome group of ladies here with us. We are on campus at Morningside University with the nursing students. So I'm just going to say hello to everyone out there, ladies.
Hi, guys.
Hi.
Yeah, so Morningside University, Courtney here, I'm going to have her introduce herself. Tell us a little bit about yourself, your role here with nursing, and also your connection with the Gospel Mission.
Yeah, my name's Courtney, and I have been at Morningside for the past academic year, but have been in education for a long time. Of course, my background is nursing. I came to Morningside just for the amazing opportunities that the program has and for the team and the students. So it has been just a really, really great place for me. I am an associate professor here, and I volunteer at street medicine at the Gospel Mission. So that's something I've just been doing since 2021, and I absolutely love it. I love population health in general, and it's given me an opportunity to get to know individuals that have a very different lifestyle than my own, and a way that I can use my gifts and also minister to them. And this year we had a great opportunity that we can take nursing students to street medicine, and not only street medicine, but just the Gospel Mission in general. So they were able to witness themselves, people that live at the gospel, people that use the gospel for meals, things like that. They got to go to the food pantry, the women and children's shelter, and also just hear about all the things that you do for individuals in the community.
That's awesome. I'll have you ladies go ahead and introduce yourself, share as much or as little as you want to.
My name is Dani Peterson. I am a senior here at Morningside. I'm also the president of MSNA, which is a Morningside Student Nurses Association here on campus, and that's a student-led group that we have. And I've been a CNA for a long time. I work at Unity Point downtown after the recent name change, in the ICU, which has gotten me a lot of different opportunities, and I've loved being at Morningside.
Awesome.
Hi, my name is Ella. I'm also a senior here at Morningside. I am the secretary of MSNA Soar Nursing Club. And yeah, Courtney took us to the Gospel Mission a couple months ago, and it was really eye-opening, and it was a really good experience for us students.
Last but not least.
Hi everybody, my name is Amanda Haverhals, and I am the department head for all of our undergrad nursing programs and health science programs at Morningside. So we're excited to have the Gospel Mission here and be a part of what they do in Sioux City.
So just share briefly, what prompted all of you get into nursing? There's some in particular, hey, I really want this.
Take it away, ladies.
Well, I think if you were to ask any nursing student, they would probably give you a similar answer. It's to help people. I know that's why I went into nursing. When I was in high school, I got my EMT, and I was volunteer on my fire department for 3 years. So, I don't know, serving others, it just kind of showed me that I wanted to be a nurse, so that's kind of what led me into the nursing.
Very nice.
My mom and my grandma were both nurses,
okay.
So I like to tell people I was really original in my career choice. But I thought I wanted to be a social worker when I was in high school because of the aspect of helping people as well, but I found out that they don't make as much money. And so then I went into nursing, and what I really loved about nursing is the totality of care that you have. You're looking at an individual from the aspects of science, but then you also have kind of what we talk about in pop health, those other things that can impact a person's health, such as their home environment, what they have access to. And I just love also having that relationship with people. One of the things that happened to me when I went to the ICU was I missed working in those retirement homes or long-term care facilities where you kind of develop that relationship with people. And so that's what kind of got me into home health. But again, it's kind of that single thread of helping somebody in a lot of different ways, whether that be science or through other things.
Very nice. Courtney, you've been doing it, I don't know, the longest here. But like, what's what got you into nursing?
Graduated nursing school in 1998, and I actually wanted to be a cosmetologist.
Okay.
So my mom was a cosmetologist. I'm like, yep, that's what I want to do. And she's like, absolutely not. And I have no one in my family that had any healthcare background. And so I'm like, well, nursing sounds good. I'm going to do that. So I went into nursing and never looked back. And it has been such a fulfilling career. I mean, I've worn many hats, but I of course I love academics, but I kind of get the best of both worlds. I get students, and I get to still, when I go to street medicine, I get that feel of taking care of people. And yeah, it's really looking at a person holistically is so important. And I think sometimes we forget that. We've talked a lot about that, where we look at, as nurses, sometimes we're just so honed in on that physical aspect of care that we forget about the mental, emotional, spiritual well-being of our patients and how much that impacts their lives. And so I think we just have opportunities, and that's why I love nursing. I can use my gift and help others.
Absolutely.
I went into nursing. It goes all the way back from childhood. I dressed up in Halloween several times as a nurse. I mean, it was just always what I was going to do. I think the aspect of caring for people and helping people was a huge part of that. And I think one thing about nursing is that, and Courtney kind of alluded to this, is that the amazing part of it is you can do a lot of different things with nursing. You can be a nurse in an education setting, in a school system, in a hospital, in a home setting. You can work for an insurance company. You can be an investigator. I mean, there's just endless amount of opportunities in nursing, and whatever fits your life at this point in time or whatever, there's just a lot of different opportunities. So I think that's what always appeals, is another thing that appeals to a good reason to be a nurse.
I think that's what is so great about Morningside is like our sophomore and junior year was kind of shaped towards like learning all the nursing material, learning the diagnosis and stuff, but really our senior year it's kind of been more focused on, okay, how can we take care of the patient as a whole? How can we help them spiritually, culturally? How can we integrate all of that to give them the best care possible? So we've gone to some pretty cool places. We went to Winnebago and helped out there in the classrooms and in the hospital and stuff. We came to a gospel mission. So like just seeing different parts of the community and how you can correlate that into nursing has been very beneficial.
Very good. So as Courtney said earlier, you guys had the opportunity to come to the gospel mission. Now, being a nursing student, 21 years old, never being at the gospel mission before, what was your expectations, leaving campus and then coming on to our campus?
Well, I am kind of from the Siouxland area, so I've heard of the gospel mission, but I've never been there. So I really didn't know what to expect. We were kind of all, I don't think really anybody in our class knew what to expect. But it was really cool. Everybody there was so nice and respectful.
And I think like sometimes we just think of like organizations like the gospel mission as like they just help provide either like just a place to stay. But then you guys had even talked about all those different programs that you guys have where workers start to become more time like full-time employees at the gospel mission, starting out as being one of the people that utilize those resources. And that's one of the things I really love about kind of what Ella said with Morningside is it's not just being a hospital nurse, and it's learning a long-term solution to somebody's problem. And to see that being instilled within the gospel mission and having that solution for people was just really eye-opening.
Mm-hmm. Definitely built, I don't know, leaving the gospel mission, I just had like, definitely builds a lot of like empathy and like you see patients in the hospital, but once they're discharged, you don't really know what their lives are like outside of the hospital. So that was just kind of a different perspective to see, and I don't know, I think it definitely helped me with understanding that you never know what somebody's going through.
Yeah, kind of like what you said there, Courtney, you alluded to it like holistically. And we talked about the same exact thing. It's not just a bed. There's a lot of other things spiritually, I would say number one, but there's a lot of different things that go on with someone. And I just thought it was interesting because if you guys were there, it's like, you're probably going to run into a lot of these type of people, I would say. Ones who you walk through your doors and you don't know what's going on, right? It's high stakes right then and there, like the anxiety, the depression, the outbursts of anger. You just don't know what's going on, so you really got to dance in the moment with them, especially for you as nurses, regardless of where they came from. They're struggling with something. They're not just coming to you to say, hey, I just want to check in on you, right? So, I know it was awesome having you ladies on campus. So going in, not a whole lot of expectation, but I think you kind of talked a little bit about Ella. The empathy was one thing that you took away from the time there.
Well, I didn't really realize how many things the gospel mission, kind of like Dani said, offered. Like the men's housing, the women and children's housing, and then I didn't know really anything about the store and like the donations you guys take. And just kind of the whole process. I didn't realize how big of you guys really kind of think of every aspect of trying to help the community. So that's really cool to see.
Yeah. I think also, as a nurse or a nursing student, especially in my job in the ICU, I've had frequent flyers who come, and it's really sad to have a frequent flyer in the ICU because that is such a critical environment. But there have also been times where I had to, one nurse and I, wheelchaired a patient across the street, Jackson Street, and had dropped an individual off to get picked up by a taxi to take him to a place that would house him. And it was so hard to just hand him his stuff and leave. And be like, I hope that everything works out. And to just be like, this is how much we can help you, to this point. And to know about resources like the gospel mission. And a lot of times, in nursing school, when we talk about holistic health, it's what resources are you going to use? And it's really easy to type, refer to social worker, refer to case manager. When, as a nurse, you're kind of an advocate for being could this work out for this individual? Could the gospel mission be a resource for them? And knowing those in the community is very helpful to have in your toolbox to kind of be aware of the needs an individual has and what solution you might have experienced in the community, which is why I think Morningside does such a great job with kind of exposing us to different aspects of care.
Courtney, I want to go back to you here. They talked a little bit. So, how long have you been with us at the Gospel Mission?
2021. 2021,
so 5 years. So I'll go back to that initial question I asked them. Your first time on campus at the Gospel Mission, what were your expectations?
I didn't know what I had not been to the Gospel Mission. I'd been to Soup Kitchen and done some serving of food at the Soup Kitchen, but I don't know, I had a coworker that was like, hey, I'm doing some volunteering at the Gospel Mission, I need some help. And I was like, I'll help, yeah, not a problem. So that's kind of how I got started, was just my friend needed help with street medicine. And then it just morphed into, I'll take a shift of street medicine on my own. And I didn't really have any expectations because I didn't know anything about it. And now I have friends who hey, I have some clothes to donate. Who takes torn and tattered clothes? And I was like, Gospel Mission. Send it to the Gospel. Take it to the Gospel Mission, even if it has stains. And I'm like, yes, even if it has stains, because they'll use those clothes and bail them, and they'll get some sort of kickback for that, and that just helps the people that they serve.
So what has been the most, in 5 years span here, what's been one of the most rewarding things? I know we talk about certain individuals that come in, hey, I saw this person, I saw that person, but what would you say the most rewarding thing of serving for the past 5 years at the mission is for you?
Just relationship building.
Yeah, it is.
I always say, I would say, oh, well, I gotta go see my friends at the gospel. So, and that's just all of you. That's you. That's the people that live there. That's the people that come in off the street. And this past month, I have a person that comes in and sees me every week. And he's been bringing me spices, like jars of spices that he concocts and makes on his own. And he's just so excited about it. And it's like, I've been with him for 5 years. And so and he knows I'm a constant there and that I'm not leaving. And he can come in and we don't really do anything. And every week that he comes in, we just chat. And I think that's part of it.
Sometimes that's all people need.
Mm-hmm.
Yeah.
And I know one of the things, part of your guys' tour with us, you were doing our food pantry, and it's kind of just, sit there. And these are people who come outside, from the community, do have a place to stay, but we even have, some of our own guests there. You were taking vitals, you were talking to them. You want to touch on that a little bit? What were some, takeaways from that? What did you notice? What surprised you? What encouraged you?
At one point, I was kind of like the bagger in the food pantry. So something that I noticed was just, I tried to talk to everybody, like, hey, how are you? Good morning. How's your day going? And just even like asking people that simple, like, how are you doing today? Like, everybody had an answer. It really opened people up, and people just really sometimes appreciate just people showing that you care. You care how their day's going. You care how they're doing, stuff like that. So that's welcome.
I was doing vitals and blood sugars while they came back from the food pantry, and this lady came up to me and she has this big bag of stuff and she sets it on the table and she's like, can you help me with my blood sugars? And I'm like, yeah, like, what do you need help with? She's like, I don't know how to use any of this. And I was like, okay, let's start from square one. What do we have here? Like, I'm like going through all this stuff, and honestly, like, I'm as lost as she is a little bit, because this is kind of equipment that might be a little different than what I've used at the hospital, but I understand the gist of what everything is. And so Bailey, another one of my classmates, she said the glucometers were similar to the ones she used at the place that she had worked in, so she was kind of helping me, and I was like, okay, like, you, like, wipe your finger off, you poke it, like, then you obviously put the little device on there or whatever, and you'll get your blood sugar on. Like, they gave you a little booklet, and like, I would write down your blood sugars, like, look, it says AM, like lunchtime and dinner time, like, make sure you're writing them down. And we took her blood sugar and it was like 300 some, which I honestly wasn't really surprised with her just now getting all of this stuff. Like, she even had it still like freshly boxed. And so, like, understanding that sometimes individuals, like, in a big setting that she might have gotten that stuff in the hospital, like, it can be very hard to learn that stuff very quickly and really instill it. And it's really easy to just go, yes, I understand, and then to go out and to be in her situation of needing to get food from the pantry and then also having to manage her diabetes was just really eye-opening to me of how important education is in the hospital setting, but also outside of it, and making sure our patients understand what's going on.
And it can be very overwhelming, and it's also the importance of just walking alongside someone. You don't have to necessarily have all the answers, but being present with them, just walking alongside them is huge. So as you girls talked about, all the different areas of the mission, you visited the thrift store, you visited our men's, our women's, you saw the food pantry, the meals. What area in particular was, say, your favorite or the most eye-opening to you?
I would say the thrift store, and like knowing about, I feel like a lot of times when I donate clothes, like a lot of people will go to Plato's because they get money or whatever.
Sure.
But then a lot of times I'll go to Goodwill, but like learning about how you guys like bail and how no resources wasted, it's always used for something, and knowing that behind like the donation really impacted me, and I actually went and donated some clothes there instead of Goodwill after I had learned about everything that the Gospel Mission did with the clothes. So that was my impact.
That's awesome.
I'm with her. I was moving like right at that time, so I was like, oh, perfect. So I took a bunch of stuff there, and then my parents were actually getting rid of a couch, and they're like, we don't know what to do with this. I'm like, take it to the hospital. So my boyfriend and I, we loaded up their huge couch and took it over, and yeah, they were very grateful. But another aspect that really impacted me was going into the women and children's shelter. My group got the opportunity to sit down with a group of women, and there were a couple of younger kids, but they just kind of told us about their story, told us, kind of talked about their faith. We talked about what gets us up in the morning, what motivates us, what helps us relieve stress, and just like, I don't know, seeing moms working so hard to get back on their feet with their little ones, it was truly, it built my empathy again. I couldn't believe that some of the stuff people have to go through.
Yeah, as I shared before, it's homelessness is very diverse. Back in the day, it was, people who struggle with alcohol. That was a huge thing, but now it's drugs, it's alcohol. It can be, hey, my boyfriend or girlfriend broke up with me, I lost a job. I mean, it can be really anyone. And then to your point there, you have a child too, and you have to try to figure all this thing called life out in this amount of time, and you have a kid.
Yeah. And it was just so cool because like the group of women we talked to, they were all so positive and like they just, I don't know.
Yeah. So I know it's been short, about a month too, but how has your time at the Gospel Mission impacted you professionally and personally?
I would say for me, kind of like what I said about working in the ICU and seeing kind of those frequent flyers who I know don't really have the best home environment or situations when they leave the hospital. It's just kind of having that in the back of my own mind as the Gospel Mission being a resource that they can utilize. Now, my role as a tech is not as influential in the patient's care, but also knowing, like, when I do become a nurse, knowing and being mindful of those resources in the community.
I would say professionally, kind of the same. I've learned to really take more time with the patients and try to learn about their entire background, try to get to know them, because that's the best way you can care for people and give them the best resources possible and stuff like that. And then personally, I thought it was so cool to see people be so strong in their faith.
So Courtney, what about you? Professionally and personally, how has your time volunteering with the Gospel Mission impacted you?
Professionally, I really have learned that a person is a person, no matter what their background, no matter what their mental health issues are, no matter what their physical issues are, that I just see them as a person. And when Jesus was walking alongside people, he didn't judge.
Right.
And so I think that personally that has really helped me, because it doesn't matter if I see them out in public, like, hey, I'm going to give them a hug because they're my friend. Professionally and personally, I guess that's both professional and personal. But yeah, I do. If I'm having a bad day, which sometimes you have a bad day and you think, this is really a bad day. I go to the Gospel Mission and it just reframes for me what a bad day is. So these people don't even have a home to go home to, and I do, and I have food on my table, and so that helps me reframe a lot. Like, my days aren't bad. It's truly a gift that I can go to gospel.
So Amanda, you had the students come, a few of them. You came back, and what did you notice in the students? How has it also benefited Morningside University?
Yeah, I think it benefits when I look at our students. I think just even them sitting here, hearing what they're saying even just right now, and I think that's important for, we really, as a program as a whole, and they talked about kind of the sophomore, junior, and the senior year and things like that, and it's really important. We have a very holistic focus. when we look at, we need to be able to take care of all that kind of that science part of nursing, and that knowing what's wrong and how are we going to help with it and how are we going to make it better kind of part of nursing. There's that whole other nursing of that art. And I think that understanding that holistic, that whole person, and going to places like the Gospel Mission really help us and help students really have a deeper and understanding and a deeper impact as they go out into their careers of the patients that they're going to take care of. And I think then it just brings it back to our program when we hear things about that, just that being proud of that holistic, that our students are talking about that holistic experience. And so we know that when we send them out into the careers, they're going to do big and bold things because they have that broader understanding, and will provide excellent care to patients in no matter what setting that they're serving in, because they've had those experiences.
I do think too that just like getting them into the community, that's a huge part of our role, is just being active in our community and being around the people that we live with. And that gospel is a great place for that.
Yeah. So start with Amanda. We'll go all the way around. Make your pitch for why people should volunteer at the Gospel Mission.
I think there's a number of things I think that we've touched on, but just to summarize, I think it's important for all of us, no matter whether we're nurses or whatever our role is in life, or wherever we're at in life, to always, I think, remembering, like Courtney talked about, people are people, and it doesn't matter where, who you are, right? You're, like she said, talked about her friend. You're my friend wherever, no matter where. And I think that that's important. I think it's important at Morningside. We also talk about our civic and ethical responsibility. And I think that that's important to remember that sometimes nursing, we can get caught up in the job part of it. But I do think that there is a part of that call and that service. And so I think that that's really important, to be that valued member of your community and to serve in other ways, even outside of your job.
Just volunteer at Gospel. I mean, I love every part of it. I go over to the thrift store and the twins are there. They sort the clothes. And so there's that. You can serve food. They serve breakfast, lunch, and dinner. There's just so many opportunities to serve there. So it's a great place to volunteer. Just do it.
So I think one thing that came to my mind was my boyfriend. He's an engineer, so a little different of a background and career, but he's like, it's so cool that you make such a big difference. Like, when you are a nurse, you are making that direct impact on someone's condition. And now, talking about the Gospel Mission, I'm like, you can make that same impact. You can do it. You can volunteer at the Gospel Mission and still make that direct impact on somebody's day, whether that be through helping through the food pantry, sorting clothes at the thrift store. There are many different ways that do not require a BSN or RN behind your name to make a difference in someone's life.
Yeah, kind of going off with all of them, I would definitely say volunteering is special. All of my volunteer experience, it not only has helped other people, but it also brings a sense of peace to myself because I know I'm helping others. So yeah, I just encourage everybody to volunteer because it really does feel good to give back to your community.
Absolutely. Well, ladies, I want to say thank you. Thank you for joining us on the episode, but also thank you for volunteering. Courtney, thank you for all the work you do all the time.
Thanks.
With us at the mission. Ladies are graduating in a month, and they're already making a positive impact, and they'll continue to do that. So it was a blessing to have you guys on here. If you want to find out about the nursing program, talk to Courtney and Amanda here at Morningside. If you want to volunteer, there you go. Yeah, there you go. If you want to volunteer at the Gospel Mission, you can check out our website at www.thegospelmission.org, or you can contact Becky at 255-1769. All right. Thank you, ladies.
Thank you.
Thanks for listening to this episode of TGM Aware. To partner with us in transforming lives, visit thegospelmission.org. Subscribe and share to help others become aware, because together we make a difference.